Arthritis isn't just one disease, it's a complex collection of conditions. It's a broad term encompassing over 100 different conditions that all share a common thread. They cause pain, stiffness, and swelling in the joints. These conditions can range from mild to severe, significantly impacting a person's quality of life. And contrary to popular belief, it affects people of all ages, not just the elderly. Children, young adults, and those in middle age can all experience the challenges of arthritis. To understand arthritis, it's helpful to know a bit about joints. A joint is simply where two or more bones meet, forming a connection that allows for movement. Think of places like your knees, hips, or even the knuckles in your hands. These are all crucial joints that enable us to perform everyday activities. Healthy joints have cartilage, a resilient and flexible tissue. This smooth tissue cushions the ends of bones, acting as a shock absorber and allowing them to glide past each other with ease, enabling pain-free movement. Arthritis happens when this carefully designed system breaks down, when the normal structure and function of the joint are disrupted. This breakdown can occur when the cartilage wears away over time, or when the joint lining, known as the synovium, becomes inflamed and irritated. To illustrate, imagine a door hinge, a simple mechanism we often take for granted. When it's properly lubricated and well-oiled, it moves smoothly and silently, allowing the door to open and close effortlessly. But if it rusts and corrodes, it begins to grind and stick, making it difficult to move the door. This is similar to what happens in an arthritic joint, where the smooth surfaces become rough and movement becomes painful. This leads to a cascade of symptoms, including pain, stiffness, and swelling in and around the affected joint. These symptoms are often most pronounced after periods of rest, such as first thing in the morning or after sitting for a long time. Over time, if left unmanaged, severe arthritis can permanently alter the joint's shape and compromise its normal function, leading to deformities and disability. The specific symptoms can vary depending on the type of arthritis, but common complaints include dull aches, sharp stabbing pain, visible swelling, redness of the skin around the joint, and a sensation of warmth to the touch. But arthritis isn't just about pain, it's about the limitations it imposes on your life. It can significantly limit your range of motion, making it difficult to perform even simple daily tasks and affecting your overall quality of life. The good news? Despite the challenges, there is hope. There are many effective ways to manage your symptoms, protect your joints from further damage, and maintain an active and fulfilling life. Understanding what's happening inside your body, learning about the specific type of arthritis you have, is the crucial first step towards taking control and living well with arthritis. Early recognition of symptoms and proactive action, including seeking medical advice, can make a significant difference in the long run. Remember, you're not alone in this journey. Millions of people around the world successfully manage their arthritis every day, leading active and fulfilling lives. Arthritis is a prevalent condition affecting millions worldwide, impacting their quality of life. The two most common types of arthritis, each with distinct characteristics and treatment approaches, are osteoarthritis and rheumatoid arthritis. Understanding the differences between these two is crucial for effective management and care. Osteoarthritis, often referred to as OA, is the wear and tear type of arthritis. It's a degenerative joint disease that gradually worsens over time. In osteoarthritis, the protective cartilage within the joints breaks down, leading to bones rubbing directly against each other. This friction causes pain, stiffness, and reduced range of motion in the affected joint, especially after activity. Osteoarthritis commonly affects weight-bearing joints, such as the knees, hips, and spine, due to the increased stress and pressure these joints endure daily. However, osteoarthritis isn't limited to these areas. It can also affect smaller joints in the hands and feet, leading to discomfort and difficulty with fine motor skills. Rheumatoid arthritis, or RA, presents a different picture altogether. It's not simply a result of wear and tear. Rheumatoid arthritis is an autoimmune disease, a condition where the body's own immune system mistakenly attacks healthy tissues, specifically the lining of the joints, causing inflammation and damage. RA often begins in the smaller joints of the hands and feet, and it typically affects joints symmetrically, meaning the same joints on both sides of the body are affected. Beyond joint pain and swelling, rheumatoid arthritis can also cause systemic symptoms like fatigue, fever, and even unexplained weight loss, reflecting its impact on the entire body. Morning stiffness is a common symptom in both types of arthritis. In osteoarthritis, this stiffness usually eases within 30 minutes of activity. However, in rheumatoid arthritis, morning stiffness can be much more prolonged, often lasting for over an hour, significantly impacting daily routines. Furthermore, RA's impact extends beyond the joints. It can also affect other organs in the body, such as the eyes, lungs, and heart. Given their distinct causes and effects, treatments for osteoarthritis and rheumatoid arthritis differ significantly. Osteoarthritis is typically managed with strategies aimed at relieving pain, improving joint function through exercise, and adopting healthy lifestyle changes to reduce stress on the joints. In contrast, rheumatoid arthritis requires medications that specifically target the immune system to reduce inflammation and prevent further joint damage. These often include DMARDs, or disease-modifying anti-rheumatic drugs. Early diagnosis and treatment are crucial for both types of arthritis, but particularly so for rheumatoid arthritis, as prompt intervention can significantly slow disease progression and prevent long-term joint damage and disability. Therefore, accurately knowing which type of arthritis you have is absolutely key to receiving the most appropriate and effective care plan tailored to your specific condition. It's essential to always consult with your doctor or a qualified healthcare professional for a comprehensive evaluation and an accurate diagnosis to ensure you receive the best possible management strategy. Beyond osteoarthritis and rheumatoid arthritis, which we've already discussed, there exists a spectrum of several other distinct types of arthritis, each with its own unique characteristics and challenges. Understanding these variations is crucial for accurate diagnosis and tailored treatment plans. Psoriatic arthritis is one such condition, primarily affecting individuals who also have psoriasis, a skin condition characterized by red, itchy, scaly patches. The hallmark of psoriatic arthritis is joint pain, and it can also manifest as a distinctive sausage-like swelling in the fingers or toes, a condition known as dactylitis. This swelling can be quite painful and debilitating. Gout is another form of arthritis, widely known for causing sudden severe pain, often localized in the big toe. This intense pain is caused by the accumulation of uric acid crystals within the joint, leading to inflammation and extreme discomfort. Ankylosing spondylitis is a type of arthritis that mainly targets the spine. This condition leads to chronic pain, stiffness, and, in severe cases, it can result in the fusion of the vertebrae, limiting mobility and impacting posture. These types of arthritis are also classified as autoimmune disorders, meaning that the body's own immune system mistakenly identifies and attacks its own tissues, leading to inflammation and damage within the joints. It's important to remember that arthritis isn't a condition that exclusively affects adults. In fact, children can get it too, and this form of the disease is called juvenile idiopathic arthritis, often abbreviated as JIA. JIA is characterized by joint pain, swelling, and stiffness in kids, which can significantly impact their daily activities and overall quality of life. Therefore, early diagnosis and treatment are vital to prevent long-term joint damage and ensure healthy development. Given the diverse nature of arthritis, each type presents with its own unique set of symptoms and consequently requires tailored treatment approaches. Therefore, accurately recognizing the specific form of arthritis is of paramount importance for effective management and improved patient outcomes. If you begin to notice unusual or persistent joint pain or swelling, especially if it's accompanied by other systemic symptoms such as fatigue, fever, or skin rashes, it's crucial to see a doctor for a comprehensive evaluation. Early intervention and appropriate management strategies can make a significant difference in slowing disease progression and improving your overall quality of life. Therefore, don't ignore persistent symptoms or dismiss them as minor aches and pains. Prioritize your health and get checked out by a healthcare professional. Remember, arthritis comes in many different forms, each with its own unique challenges, but with proper diagnosis, personalized treatment, and ongoing support, help is available for all those affected by this condition. The main sign of arthritis is joint pain, but it can feel different for everyone. Pain might be constant or come and go, dull or sharp, worse with activity or at rest. Stiffness is common, especially in the morning or after sitting still. In OA, stiffness usually fades quickly. In RA, it can last much longer. Swelling, redness, and warmth around a joint are also key signs. You might notice you can't move a joint as freely, like not making a fist or straightening your knee. Fatigue is another major symptom, especially in inflammatory types like RA. Some people feel generally unwell or have a low-grade fever. These whole-body symptoms suggest an autoimmune form of arthritis. Tracking your symptoms, when they happen, what makes them better or worse, can help your doctor diagnose the type. Don't ignore persistent joint pain or swelling. Early recognition leads to better outcomes. Listen to your body and seek help if something feels wrong. Arthritis can make daily tasks like dressing, cooking, or even walking much harder. Simple actions such as buttoning a shirt or opening a jar may become painful or frustrating. Work and hobbies can be affected, especially if they require physical effort or fine motor skills. Social life may suffer pain, and fatigue can make it tough to keep plans or stay active with friends. This can lead to feelings of isolation or frustration. Relationships may be strained, and intimacy can be affected by pain or tiredness. Mental health is often impacted. Anxiety, stress, and depression are common. It's important to talk openly with loved ones about your challenges. Support from friends, family, or professionals can make a big difference. Managing arthritis isn't just about the body. It's about emotional well-being too. Don't hesitate to seek help for your mental health. Living well with arthritis means caring for your whole self. The causes of arthritis depend on the type. Osteoarthritis is mainly due to cartilage wearing down over time. Age and joint injuries, and genetics all play a role. Being overweight puts extra stress on joints, speeding up wear and tear. Rheumatoid arthritis and other autoimmune types happen when the immune system mistakenly attacks healthy joint tissue. Genetics can increase your risk, but lifestyle and environment matter too. Smoking and certain infections can trigger or worsen some forms. While you can't change your genes or age, you can manage risk factors like weight and smoking. Understanding your personal risk helps you take action early. Prevention is possible. Healthy habits make a difference. Control what you can to protect your joints. Staying active is one of the best ways to manage arthritis. Gentle exercise, like walking, swimming, or cycling, keeps joints flexible and muscles strong. A physiotherapist can help you find safe, effective activities. Maintaining a healthy weight reduces pressure on joints, especially hips and knees. Eating a balanced diet, rich in fruits, vegetables, and healthy fats, can help manage inflammation. Medications, like pain relievers, NSAIDs, or DMARDs, are often part of treatment. Topical creams, splints, or braces can provide extra support. Occupational therapists can suggest tools and techniques to make daily tasks easier. Hot and cold packs can relieve pain and stiffness. Small changes, like using jar openers or long-handled tools, can make a big difference. Managing arthritis is about combining medical care with practical strategies. Find what works for you and stick with it. Consistency is key to living well. Don't ignore persistent joint pain, stiffness, or swelling. See your GP. Early diagnosis is crucial, especially for inflammatory arthritis, to prevent permanent damage. Your doctor will ask about your symptoms, examine your joints, and may order blood tests or scans. Be honest and detailed about your experience. Tests like X-rays or MRIs help confirm the diagnosis and guide treatment. Once diagnosed, you and your doctor will create a management plan together. Ask questions and make sure you understand your options. You might be referred to a specialist, like a rheumatologist or physiotherapist. Working with your healthcare team gives you the best chance of managing symptoms and protecting your joints. Don't delay. Early action leads to better outcomes. Your health is worth prioritizing. Get the support you need to live well. An arthritis diagnosis can feel overwhelming, but there's hope. Advances in treatment mean most people can manage symptoms and stay active. Take charge of your health. Learn about your condition and treatment options. Support groups and organizations offer information and community. Focus on what you can do, not what you can't. Adapt activities to suit your abilities. Try swimming, tai chi, or new hobbies. Celebrate small victories and be kind to yourself on tough days. Mental health matters. Reach out for support if you need it. Living well with arthritis is a journey, not a sprint. There will be ups and downs, but you're not alone. With the right care and lifestyle changes, you can thrive. Arthritis is not the end. It's a new chapter. Take the first step today toward a better quality of life.